There are two AARP associate state directors here from our state office in Baltimore. I would like to introduce Tracer Ballot. Please come forth.
Thank you so much. I'm glad to be with you all again. So nice to see so many familiar faces, and I appreciate your having me back. I work with AARP in Maryland, and I do our communications work. And so I hope that as you all sort of move along, if there's information you need or things that you want to be seeing from us and stuff that you're not getting, I hope you will stop by and talk with me today. Let me know what you need. We'll be glad to get it. I am very excited to introduce to you next my colleague, Christy Page. She is brand new to our team. As you all know, those of you I saw recently, I am new to the team about 6 months ago, and the Maryland office actually was a little bit understaffed, which is why you hadn't seen a whole lot of us for a while. Well, we are grateful that Christy is now here. She is our new Associate State Director for Outreach. She comes with a ton of experience. We're glad she's on our team. So I'm going to turn this over to her now, but we both look forward to knowing you and working with you.
I'm here to talk to you a little bit about AARP and its work with the Affordable Care Act and Medicare. I wanted to let you know that, of course, we've been working with Congress, we've been working at the state level to make sure that your Medicare benefits are protected and to make sure that those who don't have health insurance have access to it, right? You guys have heard of the Affordable Care Act, right? Right. Did you know that it actually, if you are a Medicare beneficiary, will save you money this year on your prescription drug costs? Did you know that? Yeah, see, that's one of the messages that nobody knows about, right? So that's part of the reason that we're out here today is to tell you a little bit about how this impacts your life and the lives of your families, right? So I'm going to introduce to you today Ms. Joanne Grossi, who came to us to tell us a little bit more about how the Affordable Care Act is being implemented and what it means for you and your family. She was appointed by the Obama administration in 2010 as the regional director, well, that got loud, for the U.S. Department of Health and Human Services for Region 3, which is Pennsylvania, Delaware, Maryland, West Virginia, and the District of Columbia. So I hope that you will give her a warm welcome. When we're all done, we'll be happy to open this up to questions. We'll be able to answer your questions about both Medicare and the Affordable Care Act.
The first thing I wanted to make sure you knew is that Medicare and Medicaid is part of the U.S. Department of Health and Human Services. It's one of the agencies. We call it the Center for Medicare and Medicaid Services, which is why I'm the one here telling you about it. So I'm actually going to be here today, and if I can get this to work, to tell you about the Affordable Care Act. As Christy said, some people might know it as Obamacare. We like to call it the Affordable Care Act because that's exactly what we think it's going to mean, affordable health care for all our citizens. So I like to start the presentation with this quote from my boss, Secretary Sebelius, because very often I speak to audiences who didn't support health care reform, who still don't support health care reform. I want you to know I respect that point of view, but if we can remember that what the goal of the legislation was to make sure all Americans have healthier, more productive, more prosperous lives, then I'm hoping we can have a civil discourse on what we don't agree on. So I want to tell you first why we thought it was important to do something about health care. Right now in this country, there's 48.6 million people without health insurance. If I were standing here a couple years ago, by the way, that number would have been over 51 million. But thanks to the Affordable Care Act, we already have 3 million more Americans with health insurance who didn't have it before. And I'll tell you about that in a minute. We spend the most of health care on any country in the world. We spend almost $3 trillion a year on health care. It is almost 18% of our gross domestic product. Even though we're spending all this money on health care, we are not getting the health outcomes you'd think we get. We're 45th in the world in terms of life expectancy, 29th in the world in terms of infant mortality rate. So even though we're spending all this money on health care, we're not getting the health outcomes you think we're getting. And so we in the Obama administration felt there was both a moral imperative and an economic imperative to do something about health care, because it was projected that by the year 2040, a full 1/3 of our gross domestic product would be going to health care if we did nothing. So that's why the legislation passed 3 years ago in March. So I want to tell you about the 7 or 8 things that we think the Affordable Care Act is going to accomplish. First, remember I told you a minute ago that there's 48.6 million uninsured, but there used to be 51 million? It's thanks to this very first provision. In September of 2010, it became law that all children up to the age of 26 could remain on their parents' health insurance plan. I hope there's some people in this audience whose either children or grandchildren benefited from this. In fact, 3.1 million young adults now have health insurance who didn't have it when this law got passed in 2010. So it's been a very popular provision and working exactly the way we wanted to. Second, and I hope you might have seen the Medicare trustee report just came out last week, and it showed that Medicare is now solvent until the year 2026, and they actually give a lot of credit for that to the Affordable Care Act. Contrary to what you heard during when the law was getting passed, the Affordable Care Act actually strengthened Medicare. It did not weaken it. And again, as the trustee report said, it's solvent now through 2026. I'm going to get into much more details about Medicare, but we put in some very important provisions in place that again strengthen Medicare. The other thing, a provision that I think is very important from now on, what became true in September of 2010, no longer is there a lifetime limit on your care, meaning health insurance companies could no longer impose a limit on the medical services you can receive. And I guarantee you, if you've ever had a catastrophic illness like cancer or a car accident, you hit that lifetime limit in the past very quickly. Usually it was about $1 million. But again, lifetime limits on care went away in September 2010. Annual limits on care goes away in January of 2014. What we also did is we're really reining in insurance premium rates. I am not picking on insurance companies. My sister's deputy general counsel at an insurance company. I'm glad I have health insurance, so I'm not picking on them, but some of their practices weren't working well for us. So we made a couple of changes to insurance companies. The one I want to really tell you about is we implemented something in September 2011 called the 80-20 rule. And what that means is from now on, insurance companies must spend 80% of your premium dollars on your medical services. It can't be any longer for bonuses to CEOs or trips to the Bahamas or marketing campaigns. It must be used for your medical services. And in fact, last summer, they had to start reporting to us that they were adhering to this formula. And if not, they had to give you a rebate. And in fact, last summer, 12.8 million Americans received a rebate from their insurance companies, totaling $1.1 billion. So again, this provision working exactly the way that we hoped it would. This next provision, which I actually think is the most important one of the law, from now on, starting in January 2014, you can no longer be denied insurance if you have a pre-existing health condition. And what is that? Those are things like asthma, arthritis, diabetes, cancer, high blood pressure, etc. So from now on, if you have one of those conditions, health insurance companies are not going to be able to deny you insurance or charge you a higher rate for your insurance. I think this is great news, and you should too, because I guarantee you everybody in this room either has a pre-existing condition or loves somebody who does. 47% of Americans do have a pre-existing condition. And last year, 625,000 Americans were denied health insurance for a pre-existing condition. So again, that goes away in January of 2014. It already went away for children in September, children up to the age of 19 in September of 2010. And I guarantee you that was great news for the 17 million children in this country with a pre-existing condition and their family. And finally, we're going to make health insurance more affordable for middle-class families and for small businesses. I'm going to get into those details in a little bit. So now let me spend a few minutes on Medicare. And I'm actually going to spend most of my time talking about some Medicare changes because how many people in this audience are between 50 and 64? Okay, so not many. So most are on Medicare, right? So I'm going to spend most of my time on Medicare and get into the marketplace just for a little bit. So Christy alluded to this. There's 4 really important changes to Medicare that I want to make sure you know about. First, what became true January 1st of 2011 is from now on, all your preventive services are free under Medicare. No out-of-pocket costs, no copays, no deductibles. What are preventive services? Things like mammograms, colonoscopies, flu shots, PSA test, PAP tests, anything that's preventive. those all became free for you now. Again, no out-of-pocket costs, no co-pays, no deductibles. If you haven't taken advantage of that yet, or you didn't know about that, that comes exactly through the Affordable Care Act. We hope you're going to do something about that and make sure you use those free preventive services. We're really shifting the paradigm in Medicare. We really want to concentrate on wellness and better health outcomes. And I'll give you the flu as one quick example. Most seniors over the age of 65 actually don't get a flu shot. Only about 58% of people over the age of 65 get a flu shot. Unless, and you might not know this, but flu and pneumonia is actually one of the top 10 leading causes of death. You just heard about, I wonder, Senator Lautenberg, who died yesterday from complications from pneumonia. And again, flu and pneumonia, one of the top 10 leading causes of death, completely preventable if you get your flu or pneumonia shot. And yet seniors were telling us they weren't getting it because they didn't want to put out the money for the copay. So we're making all these preventive services free now because we want you to get the shots and not get the flu and not get pneumonia, have a better health outcome, and then even save the system money, because if you're not in the hospital, we had over 300,000 people hospitalized last year for the flu. Well, if you're not in the hospital, it saves the Medicare system money, and it also has a better health outcome for you. So again, free preventive services as of January 1st. You can see here in Maryland, over 550,000 Medicare beneficiaries benefited from that free preventive services. Secondly, everybody here know about the Medicare Part D prescription drug program? Is that familiar to everybody? I hope so. So you know there's a gap in coverage, that point where you have to pay 100% of the cost. We call that the donut hole, the prescription drug plan D donut hole, we call that. We're closing that donut hole. So there'll come a point where you're no longer going to have to pay the 100% cost any longer. What we initiated in January 1st, 2011 again, was we started putting some discounts in place. We're closing the Medicare Part D donut hole as of 2020, closes completely then. But each year we're putting some discount formulas in place. So what became true January 1st of this year, if you hit the Medicare Part D donut hole, you get a 50% discount on brand name drugs, a 21% discount on generic drugs, and again, that discount formula is going to go up every year until 2020 when the donut hole closes completely. You can see here in Maryland, over 73,000 seniors benefited from this donut hole discount, saving, by the way, on average $780 a year. So real money going back into your pockets that you can use for other things. The other two things I want to tell you before I get on this slide, though, by the way, is what also became true January 1st of 2011, a free wellness visit with your doctor. So again, if you didn't know this, again, it's all part of that thinking now that we want to make sure we keep you well. So if you have high blood pressure, if you have diabetes, if you have hypertension, we really want to make sure you're sitting down with your doctor and having a one-on-one conversation on how you stay well. That wellness visit, again, is free, no out-of-pocket cost, no co-pays, no deductibles. So if you haven't taken advantage of that yet, please start meeting with your doctor annually for a free wellness visit. And finally, the last thing I want to tell you about what we changed in Medicare, we're being very aggressive about going after people who are trying to fraud our system. You may not know this, but we lose about $100 billion a year in the Medicare and Medicaid systems from people who are trying to, frankly, steal from us. So in the past 2 years, we have arrested over 1,500 people, and we've recouped over $5 billion. And we are being dead serious about going after people who are trying to steal our Medicare and Medicaid dollars. We want that money to go back into the system and make sure it's here to take care of you. The last thing I'm going to say about Medicare and Medicaid is we also instituted something called the Center for Medicare and Medicaid Innovation. And as the name implies, we are looking at really serious ways now on how do we change the health system so, again, we have better health outcomes and we also save the system money. And I'm going to give you two quick examples. My dad has prostate cancer. And when he had the cancer detected, he met with his primary care doctor and his urologist and his oncologist, but none of them ever talked together. None of them ever talked about what tests he had. And so there was duplication of tests, duplication of doctor visits. This was cost the system a lot of money and also was a hardship on my father. So that's what we're looking to change. We're creating something called accountable care organizations where it's patient-centered care so that the patient is the center of the care, and we're going to asked for doctors and hospitals to coordinate the services. So in the scenario I just told you about, my dad's oncologist, primary care doctor, and urologist all would have spoken to each other, and so they could have eliminated some duplicative tests and also some needless time and stress for my father. We think that's a better health outcome, and again, saving the system money. So we're making a $10 billion investment over 10 years to put investments into the healthcare system to come up with better health outcomes. The other example I'll give you is, you may not know this, 1 out of every 5 Medicare patients who goes into the hospital gets readmitted in the hospital before 30 days. 1 in 7 actually gets an infection in the hospital. So you actually got sicker from being in the hospital. 1 in 7 gets a hospital-acquired infection. 1 in 5 gets readmitted to the hospital in 30 days. And we started saying to hospitals and providers last year, we are not going to keep paying you for making someone sicker, that you didn't take care of them. We're not going to keep paying you for that. We're going to start paying you for your health outcomes and the quality of care you give people. So starting in September of last year, we started penalizing hospitals financially if they had high hospital-acquired infection rates or high readmission rates. So those just are 2 examples that we're trying to do under the Center for Medicare and Medicaid Innovations, and already in the first couple of years, they're working because, again, that's what the Medicare trustee report said was working, and why now Medicare is solvent until 2026. So those are